Hello everyone and welcome to the lecture on Amazon Comprehend Medical. So this lecture will contain all these topics. What is Amazon Comprehend Medical? Important notice and use cases. How it works. Text analysis, API operations. Anatomy and behavioral, social health categories. Medical condition and medication categories. Detect PHI operation. So what is Amazon Comprehend Medical? Amazon Comprehend Medical is a service that identifies and extracts useful information from unstructured clinical text, such as physician's notes, discharge summaries, test results, and case notes. It uses natural language processing (NLP) models to detect entities which are textual references to medical information like medical conditions, medications, or protected health information (PHI). Links entities. So the service also allows users to link those detected entities to standardized medical knowledge bases such as RxNorm, ICD-10-CM, and SNOMED CT through its ontology linking operation. Important notice and use cases, not medical advice. So Amazon Comprehend Medical should not be used as a replacement for professional medical advice, diagnosis, or treatment. Confidence scores. So the service provides confidence scores indicating the accuracy of detected entities. Users should identify and use the right confidence threshold for their specific use case, employing high thresholds where high accuracy is critical. Human review. So in certain situations, particularly those involving patient care, the results from Amazon Comprehend Medical should be reviewed and verified by appropriately trained medical professionals. Case management. Doctors and healthcare providers can use it to manage patient cases by easily accessing medical information from narratives, which can help in identifying candidates for early screening of medical conditions. Clinical research. Life sciences and research organizations can use it to improve the process of enrolling patients into clinical trials, enhance pharmacovigilance, monitor adverse drug events, and assess treatment effectiveness by extracting information from clinical texts. Medical billing. Payers can use it to expand their analytics to include unstructured documents, helping to determine appropriate billing codes and improve computer-assisted coding (CAC), thereby decreasing time to revenue and improving reimbursement accuracy. Ontology linking. The service can detect entities from clinical text and link them to standardized concepts in common medical ontologies. So we have Infer ICD-10-CM, which links to medical conditions, Infer RxNorm, which links to medications, and Infer SNOMED CT, which links to medical concepts like anatomy, test, treatments, and procedures. So how it works? So first is NLP model. So Amazon Comprehend Medical uses a natural language processing model that is already being trained to understand medical language. Analyzes text. It is designed to read and understand clinical text that is not structured like doctor's notes. Entity detection. So the system identifies important pieces of medical information called entities. These can be things like medical conditions, for example, diabetes, medication, for example, insulin, or protected health information, for example, patient names. Ontology linking. Some operations can go a step further by not just finding these entities but also linking them to standardized medical classifications or vocabularies known as ontologies. This helps in standardizing the information. No user training. You don't need to provide your own training data because the model is always being updated and trained on a vast amount of medical texts. Confidence scores. Every piece of information it finds comes with a confidence score. This score tells you how confident Amazon Comprehend Medical is about the accuracy of what it has detected. Two operation types. So you can use the service in two main ways, synchronously and asynchronously. Synchronous operations. These are for analyzing single documents one at a time. The results are sent back directly to your application, which is great for interactive tools where you need quick analysis of one document. Asynchronous operations. So these are used when you have many documents to analyze, like a whole batch stored in an Amazon S3 bucket. The system processes them and sends the results back to a S3 bucket. So text analysis API operations. So first we have single and batch analysis. So Comprehend Medical allows you to examine the clinical documents to gain insights using pre-trained NLP models. This can be done for individual files or through batch analysis for multiple files stored in a single Amazon S3 bucket. Then we have this API called Detect Entities V2. So this operation examines unstructured clinical text to detect textual references to medical information such as medical conditions, treatments, tests and results, and medications. There is also an older Detect Entities API, but the version 2 uses a different model with some output changes. Then Detect PHI, which is Protected Health Information. This operation specifically examines unstructured clinical text to detect textual references to protected health information like patient names and addresses. Categories. So within this is under Detect Entities V2. The Detect Entities V2 operation can detect entities across several categories, and it could be anatomy, which are body parts, behavioral, environment, social, which are health impacting behaviors and conditions, medical conditions, which can be signs, symptoms, and diagnosis, medication, which is medication and dosage, protected health information, which is patient's personal information, test treatment procedure, which is diagnostic procedures, and time expression, which is time related entities associated with other entities. Then we have detected information classes. So Comprehend Medical detects various classes of information, and these are entities which are the text reference. For example, Brufen. Category, the group it belongs to, for example, medication. Next, for example, type, specific type within a category, for example, generic name for Brufen. Attribute, which is related information, for example, 200 milligram dosage for Brufen. And trait, which is contextual understanding, for example, negation, if a patient is not taking a medication. And a relationship type between, which is between entity and an attribute. Then we have scores. Every detected entity and attribute comes with a score that indicates Comprehend Medical's confidence in the accuracy of the detection. Attributes also have a relationship score indicating confidence in their link to the parent entity. Anatomic category. So this category is used to detect references to parts of the body or body systems, as well as the locations of these parts or systems. Then we have type. So we are actually on the second topic. This is anatomy and behavioral and social health categories. So I just covered the anatomy category, and this is about the body parts and their locations. Next we have the type. The primary type within anatomy is system organ site, which refers to body systems, anatomical locations or regions, and body sites. Then we have attribute, which is a key attribute detected is direction, which includes terms like left, right, medial, lateral, upper, lower, and so on. Behavioral environmental social category. This category identifies references to behaviors and conditions in a person's environment that have have an impact on their health. Specific types detected include alcohol consumption, use status, frequency, amount, and duration, allergies and responses, gender, which are identity characteristics, race, ethnicity, which is social political identification, drug use, which is recreational drug use, status, frequency, amount, and duration, and for example, tobacco use, status, frequency, amount, and duration. Then we have attributes for alcohol, tobacco, or recreational drug use. For alcohol consumption, tobacco use, and recreational drug use, attributes such as amount used, duration of use, and frequency of use are detected. Next, we have traits for alcohol, allergies, tobacco, and recreational drug use. Traits like negation, indicating something is not happening or not being used, and past history, indicating use prior to the current encounter are identified. Next, medical condition and medication categories. So first we have medical condition category. So this category identifies signs, symptoms, and diagnosis of medical conditions. Type, the main entity type is DX name, which covers all listed medical conditions including present illnesses, reason for a visit, and medical history. Attributes related to DX name include acuity, like chronic or acute, direction, for example left, right, system organ site, which is anatomical location, and quality, which is a descriptive terms like stage or grade. Then traits, various traits can be associated such as diagnosis, a determined condition, symptom, patient reported condition, sign, which is physician reported condition, negation, which is condition not present, hypothetical, condition expressed as hypothesis, low confidence, condition expressed with high uncertainty, and pertains to family, condition relevant to patient's family. Then we have medication category. This category detects medications and related dosage information for the patient. And we have types. Entity types include brand name, which is the copyrighted name, and generic name, non-brand or ingredient name. Attributes include dosage, which is the amount ordered, duration, how long to administer, form, for example tablet or liquid, frequency, how often, rate, like administration rate, for example for IVs, and route or mode, administration method, and strength. Then traits for medications are negation, patient not taking the medication, and past history. Medication is from a time prior to the current encounter. So next we have detect protected health operation, PHI operation API. So the purpose is of this operation is this operation should be used when your primary goal is to detect only protected health information from clinical text. If you need to detect all available medical entities, you should use the detect entities V2 operation instead, which I talked about earlier. So this has HIPAA identifiers. So detect PHI helps identify entities related to the 18 identifiers specified under the HIPAA safe harbor method that must be treated with special care. While the detected entities don't map one-to-one with this list, Amazon Comprehend Medical covers all relevant identifiers found in unstructured clinical text. So this knowledge is very specific to this Comprehend Medical and how HIPAA has some guidelines on 18 identifiers and how it maps from this PHI operation to the HIPAA. Then confidence scores. So every PHI related entity detected comes with a confidence score. It is recommended to evaluate these scores and choose an appropriate threshold for your use case. For compliance scenarios, using a low confidence threshold can help capture more potential PHI instances, especially when the actual values of the detected entities are not being used directly. Then detected PHI entities are some of them are, so the type of PHI entities that the detect PHI can identify include age, date, name, phone or fax, email, various forms of ID like social security numbers, medical record numbers, account numbers, license numbers, device numbers, biometric info, URL, address including the named medical facilities, and profession pertaining to the patient or their family. So example output. So when using detect PHI, the response is in JSON format. It lists each detected PHI entity with details such as its ID, character offsets like begin offset, end offset, indicating its position in the text, the confidence score, the actual text of the entity, its category like protected health information, its specific type, for example, name or age, and any associated traits. And that's all. Thanks for watching.